Hi, I'm Dr. Sylvestre with Focus and Flourish. In this video, we're going to learn how to create a donut to help your bandaged patients. A donut is typically applied to help protect a bony prominence from being rubbed by the bandage and therefore creating a sore. The other reason for applying a donut in a bandage is if you have a foreign object, let's say a piece of glass, and you want to bandage the area, but you clearly don't want to apply pressure on that foreign object on that glass. So you would put the donut around the glass and bandage it and then get the patient to the appropriate place to have that piece of glass removed. This is not such a common use in veterinary medicine because the patients just come to us with that foreign object. We deal with it, then we bandage. We don't have, paramedics or being sent to a different department and that kind of issue. Let's have a quick look at the common places where a decubitus sore is likely to develop. On the forelimb, the olecranon is a common spot, clearly with a bandage that goes above the elbow. Lower on the limb would be where the accessory carpal bone is, or that carpal pad. They're in the same area, just behind the carpus itself. In the dogs with thin hair, sort of like the Greyhound family dogs, the Whippets, Vizslas, those kinds of dogs, we can see decubital sores develop at the metacarpal phalangeal joint. They tend to be a little bit prominent, and I think because they don't have much protecting their skin there, so that could be either medial or lateral, and an issue might develop there. On the hind limb, we could also get a problem at the metatarsophalangeal joint, but we tend to not see that quite so often, and maybe it's because of the type of injuries that our patient gets. And of course, in the hind limb, over the calcaneus, at the point of the hock, big problem there. So these are the areas you need to keep a close eye on for the formation of the decubitus sores, and perhaps apply a bandage. What makes these wounds more difficult to manage than any other kind of wound, because it's over a bony prominence, so there tends not to be maybe great blood supply that arrives there because it's just bone. There's not a nice big vascular muscle sitting over the prominence. It's also hard to bandage because usually it's the bandage that created the sore to begin with. The wound tends not to close well on its own because it's over a bony protuberance and usually in an area that moves. Surgically closing these wounds also has a whole load of difficulties associated with them for the same reasons. Over a bony prominence, over an area that moves, if left untreated, you can get osteomyelitis that occurs within the bony prominence that now becomes exposed. So they can be very nasty wounds. This is my favorite technique for creating a donut. Use a roll of gauze cling, 1 or 2 inch, depending on the size you want to make. Wrap it around. I've got 3 fingers. If I wanted a bigger one, maybe I'd use 4 fingers. And I'd wrap it around those fingers a couple of times to create what I'm going to call the skeleton of the donut. Once I have that skeleton created, I'm going to use the rest of the roll of the gauze cling to wrap around the skeleton in a bit of a forward-moving fashion, a bit of a spiral wrap fashion. So keep on going through the central loop and back out and around and moving around the donut. This will build up some thickness to the donut. Our goal is to create a nice, regular, flat, circular ring with a hole in the middle. That's why we call it a donut. Now, the thicker you want to make it, the more of that gauze you're simply going to use to wrap around. But make sure that the key is that your central hole is of appropriate size for the bony prominence that you're trying to protect. Once you get to the end, tuck the little piece back onto itself so it doesn't just unravel on you. And there you go. You have a nice donut that will be able to fit over a bony prominence and protect it from the bandage. Once your donut is made, it is really important that when you apply the donut to the bony prominence, that your donut bandage actually lays above the bony prominence. So the whole point of it is that your bandaging material, your cotton padding, is not going to rest directly against the skin. So if you made your donut really big, you've got a great big opening for the donut and you apply it on the limb, and it kind of includes, all of the patient's hock, let's say, you're really not protecting the bony prominence well. I hope this makes sense. So it's important that your donut fit properly. In our hospital, when we would have some downtime, our techs would actually just create donuts of different sizes, small, medium, and large. That's a little bit generic, but often they would find the appropriate size donut for that appropriate patient and didn't have to spend the time creating the donut with the patient there. So we had baskets with different size donuts in there for us to use when necessary. I hope you found this video helpful. Please hit the like button and subscribe to our channel.